Hello, everybody. My name's Derek Wallace, doing this presentation for pathophysiology, which is MDMA assisted therapy for depression and anxiety disorders. Some of the current treatments basically are baseline treatments for anxiety disorders and depression. The currently first-line treatments for depression, such as SSRIs, typically take about 6 weeks to produce therapeutic change, which can be difficult for some people who struggle with mental illness and need a fast relief. Some of the current treatments for mental health is such therapy such as electroconvulsive therapy for the treatment of resistant depression, TRD. Transcranial magnetic stimulation, which is used for multiple conditions such as OCD and major depressive disorder, MDD. Cognitive behavioral therapy, which is the basic, therapy that most people go through for depression, anxiety, whatnot, is basically more so involved with talk therapy. MDMA, most called Molly or ecstasy for most people on the streets, but in the chemical lab, chemists, whatnot, the chemical name for it is methylene dioxymethamphetamine, which is made in a lab as a synthetic drug. Sold as tablets, capsules, powders, and as liquids that some people put on like stamp bags and whatnot and sell them on the street. Some people consider it to be a psychedelic drug due to the ability that it causes altered visual and state or loss of time perception. It became popular and used, in the 70s as a psychotherapy that one of the chemists named Alexander Shulgin discovered some of the therapeutic properties and tried promoting it to other people, that would use it in the therapy setting. But not long after all that, the street drug Molly ecstasy was discovered in some of the nightclubs, and it became illegal in the United States in 1985. Here are some of the neurotransmitters that MDMA activates that influences the person's moods and behaviors. We have serotonin, oxytocin, dopamine, norepinephrine, which are the main four that that plays a role in the effects of the drug, such as serotonin plays in the role of regulating the mood, sleep, the pain, and the appetite of the person. The oxytocin plays a role with the social bonding, trust measures, trusting of people, whatnot, and empathy. The dopamine, which plays a role in pleasure, motivation, and focus to some extent. Norepinephrine plays the role in alertness, increases the heart rate of the individual, and increases their physical energy. Not only with those neurotransmitters, MDMA also rapidly increases the availability of the extracellular 5-hydroxytryptamine, which is 5-HT, which mirrors some of the action of commonly prescribed antidepressants. Here is MDMA assisted therapy which is usually assisted in therapy under a medical supervision, which is usually combined with treatments such as talk therapy, and they use it for research and studies, basically, in clinical studies. They play a part in the treatment of depression as either the rapid onset pharmacological agent or as an adjunct to psychotherapy. Normally the participants usually take 125 milligrams capsule, which is MDMA chloride, with an option to have a supplemental, dose, which is usually 62.5 milligrams. They usually feel the effects between 30 to 60 minutes, which, peaks a few hours within to the therapy treatments, which, can last up to 6 hours. Participants sit or lie down. Usually they have glasses, eye shades, and headphones to listen to some calming music, whatnot. which they try to promote the music to help, improve the experience and outcome of the session. It works as an adjunct to psychotherapy, where it is thought to assist, the therapy session by strengthening the therapeutic relationships between the patient and also the therapist. Here's, some information on the clinical trials involving MDMA-assisted therapy, which, as I've spoken earlier, it's used to treat anxiety disorders such as PTSD, depression, but it's more popular right now, more known for PTSD. It makes it easier to talk about stress, trauma, or to reprocess some of the painful memories that the patient, the participant, was involved in, which without it, they would have a hard time processing and talking about some of the, the issues that brought them some of the trauma, such as, military history, abuse, they're involved in an accident. So it would help, understand some of the emotions, some of the factors that cause them some of the stress and some of the trauma that they're going through. So it may help their lower stress levels, see problems in a new way, and their ability to remember and confront those memories and have the understanding to work the emotions and social relationships more effectively. Some of the participants that have attended some of the clinical trials and followed up with their visits after it's ended had significant reductions in their pretty much depression rating scale, which is the MADRS, Montgomery-Åsberg Depression Rating Scale, and also the Sheehan Disability Scale, which is SDS, compared to when they started their treatment, their baseline. Some of the potential benefits of MDMA-assisted therapy would be, the rapid onset of the treatment, the rapid, besides their already, drugs that they were taking, the SSRIs, SSRIs, whatnot. So that's a little benefit of the MDMA-assisted therapy, that it works, you feel the effects a lot faster than the other already existing treatments. You have the improved trauma processing, their better sleep, their improved communication, some of their therapeutic relationships. They have an easier time bonding and trusting and going through the talk therapy. And, of course, some of their reduced depression and anxiety that what their end goal is. There's to the potential risks, which would be, nausea, decreased appetite, you've got your faster heart rate, your blood pressure rises, difficult concentrating, and sometimes your motor coordination, your balancing is a little off. But some of the more serious risks would be the hypothermia, the rise in body temperature, the heart problems, potentially liver damage, and more related to some of the recreational ecstasy, Molly that people get on the streets. It could be contaminated with fentanyl. It could be interacted with other potential drugs, that would give the person an increased high that can obviously cause like an overdose and death. Because recreationally, most ecstasy pills do not contain just MDMA pure. It's, according to the government reports, yet, they want you to avoid using or buying on the street because of that potential risk. But on the treatment level, therapy level, they also want you to avoid using it with antidepressants, stimulants, the alcohol, the opioids, and also if you take any kind of muscle relaxants. And of course, MDMA isn't approved by the U.S. Federal Drug Administration, but they have, designated it as a breakthrough therapy. So they can expedite the research, find out more about it, see how it treats the participants that come in for clinical trials. which is why it's only legal in clinical trials, because since it's a Schedule 1 controlled substance currently in the United States. Here are some of my references that I got the information from for Mdma At. There was a lot of information involved in it, so there was a bunch of information I had to break down to try to make this type of presentation, which I hope you gained some information on the subject. I hope you learned a little bit more about it, and obviously I hope the government, either, hospitals or universities take more initiative into finding out more about the anxiety and depression treatment that it could benefit than just, regular drugs like, SSRIs or, any other kind of illegal substances like psilocybin that some people use. But, because some of these SSRIs do come with a lot more side effects also, which a lot of people don't really like. It can make some people gain weight. It can make, your muscles sore. It can make some people sick, nausea, upset stomach, whatnot. So anyway, again, I just hope you enjoyed this, and, wish you all the luck.